All right, so this next one, a lot of you I know are familiar with. It's the Thomas test. This is basically checking out your hip flexor muscles and then trying to sort through and figure out which ones are a little underactive and maybe which ones need some activation. So for this test, you're gonna find a hard surface, one that's not gonna flip on you. You're gonna let the butt slightly hang off. We're gonna pull both knees toward the chest. You want the lumbar flat on the table. So I'm orienting my pelvis to be relatively neutral. We're gonna hold with the arms, one leg up toward the chest, and then just fully relax and let the other leg fall as low as it's gonna go. So I'm not doing anything with this leg at all. It's just completely relaxed, and then we see where it falls in a resting posture. And then we would come up, switch sides, and we're gonna get a good look from side to side what each of those legs are doing. Now this side view that I have here is really good to see if my quads are tight, which they are. You can see how far out in front the foot is of the knee. And also if the psoas is tight, you'll see that the knee is relatively elevated compared to the hip. With a relaxed hip flexor, the knee will be a little bit below the hip. The other angle we'll look at is directly from the feet. Same exact setup. We'll let that leg down, and what we're looking for is if the leg is trying to abduct out to the side and slightly externally rotating. If that is the case, then you're looking at tight TFL and or sartorius. So in the other position, we were looking at psoas, maybe iliacus and rec fem, which is the tight quad. In this position, TFL and sartorius, which is a tricky little bastard that spirals across the front of the leg. So whenever you're talking about having tight hip flexors, just because you have pain somewhere doesn't mean that it's tight, or just because I sense that it's tight. Sometimes that just means it needs to be activated, sometimes it needs to be released. It's always best to test, not guess, and I hate that I picked up that saying from NKT, but it really does hold true, because you could be stretching something that's underactive, you could be trying to activate something that's overly active, and then just running your head into the wall trying to figure out. So this gives us a definitive view on what exactly is going on in a resting posture. So that's the best way to go about figuring out how do I fix hip flexor dysfunction.